I'll turn things over now to Dr. Fitzgerald for the latest update on numbers.
Thank you, Premier. Good afternoon, everyone, and thanks for joining us today. Since the media advisory yesterday, we have one new case of COVID-19 in our province in the Western Health region. The individual is between the ages of 60 and 69, and the case is related to travel within Canada. The total number of cases in our province is now 1,021, and there are 4 active cases. No one is in hospital due to COVID-19, and a total of 125,781 people have been tested to date. We've had only one travel-related case in the last 5 days, which is quite remarkable, considering that many provinces in Canada are seeing a significant spike in cases. It is truly a testament to everyone's commitment to keep the COVID wave at bay. We have been working closely with the Newfoundland and Labrador English School District and the Department of Education over the last few weeks to find a way forward for in-class instruction for high school students. As a media release earlier today has indicated, effective Wednesday, April 14th, high school students will be able to return to class in a modified scenario 2. As we have said many times before throughout this pandemic, public health has to strike a balance between reducing COVID transmission and protection of the population with overall health. And we recognize the importance of school in the well-being of all students. The Newfoundland and Labrador, the strategy that the Department of Education and the Newfoundland and Labrador English School District have developed strikes this balance as best as possible at this time under the current public health guidance. We will continue to work with the Department of Education and NLESD as high school students return to the classrooms. As always, our decisions will be made balancing the potential for spread of COVID-19, especially variants of concern, vaccination rates in priority groups and the general population, and the importance of children being in school. We are doing very well with our vaccinations, and as of April 5th, the province has administered just over 90,000 doses. Over the last week alone, the province has received 43,780 doses of vaccine, which represents 34% of all vaccine the province has received since December of 2020. It is important to remember the significant logistical work that happens behind the scenes from the time a vaccine arrives in the province to when it is administered. When a shipment arrives, regional health authorities generally have it fully administered within 1 week. This week, we had an unexpected shipment of 20,000 doses of vaccine. When we know a vaccine shipment is en route, we have time to plan. When an unexpected shipment arrives, regional health authorities move to action as fast as possible to plan for distribution. This involves scheduling vaccination clinics, determining priority groups that can receive the vaccine, and sending notifications to book immunization appointments. Vaccine supply is often unpredictable, but we are grateful for every single dose that arrives, whether expected or unexpected. Before I conclude today, I would like to acknowledge a valued member of our team that retired last week, Neil Butland. Neil has had a long career, over 30 years, working with both Eastern Health and the Department of Health and Community Services. As our long-standing employee in our public health vaccine depot, his expertise has ensured efficient vaccine distribution through a couple of pandemics, many influenza seasons, and for so many children and adults in our province. We have the highest childhood vaccination rates in the country, and there is so much that goes on behind the scenes to make that happen, of which Neil has been an integral part. Neil, you have been such an important member of the public health team, and your work has contributed so much to the health and safety of our population and touched more lives than you will ever know. So on behalf of everyone on the team, I wish you the best in your retirement, and I hope you are enjoying some well-deserved rest. As a recap, for those who may have just joined us, we have one new confirmed case since yesterday's media advisory, and the total number of cases in our province is 1,021. Today marks World Health Day. This year, the World Health Organization is calling for action to eliminate health inequities. The entire world has been impacted by COVID-19, but this impact is magnified for communities which were already vulnerable in their health status, their ability to contain the virus, and with poor access to quality health care. We must strive to take the lessons of the COVID-19 pandemic and use them to improve health equity for all. Everyone is impacted by COVID in some way, and some more than others, and that's why it's important to support those that need it most. We can all make a difference, no matter how small our contribution. A simple gesture can mean the world to someone else. So remember kindness and compassion, and hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald, and certainly congratulations to Neil, wishing you all the best. It's so encouraging to see such low numbers when it comes to COVID-19, with just 4 active cases in our province today, especially given what the rest of the country is going through. And it's equally encouraging to hear increasing numbers when it comes to the number of people getting vaccinated. Over 90,000 doses already administered, with over 9,000 people getting their second dose to date. We are indeed on our way back to a more normal way of life. And after consultation with Dr. Fitzgerald and her team at Public Health, the school district, and the Department of Education, who have worked tirelessly to bring students safely back to high school and the classrooms they deserve to be in. This is welcome news to many students and parents, I know, and I'd like to thank them all for being patient with their school staff and their teachers. To all students, children heading back to classes after the Easter break, please know that we are doing all we can and will continue to keep you safe. It has always been our #1 priority and will remain so. As we've said many times, we must continue to learn to live with COVID-19 by following the guidelines of Dr. Fitzgerald and her team at Public Health. With that, I'll turn things now over to Dr. Haggie, who joins us in person today for the first time in quite some time. Welcome back.
Thank you very much, Premier. It's been just over 3 months since I was last here in person, and it's nice to be back on deck. I just want to acknowledge today is also Green Shirt Day for the effect that Logan Boulay of the Humboldt Broncos had on organ donation in this country. It is easy for Newfoundlanders and Labradorians to identify themselves now as organ donors through MCP card or driver's license renewal, and you can do these online, and I would encourage you to do so. We've heard Dr. Fitzgerald and the Premier reference vaccine shots. These will now be reported on a daily basis through the hub. There will be a 24-hour lag, so that is to make sure our figures are as accurate as possible, particularly when coming from more rural sites. As has been referenced, we have as of the end of last week, we had administered about 88,000 doses, and we're now over 90,000. At the weekend, we had 2 deliveries, one predicted, which is our regular weekly supply of AstraZeneca, and our fortnightly supply of Moderna. That was all accounted for in the clinics that were booked over the coming week and will be distributed and administered by the end of this next 7-day period. The AstraZeneca is slightly different. Those clinics are a separate and parallel stream. They don't mix with the mRNA vaccine in terms of the way they're administered, and they are actually separate clinics. Open calls have gone out in Western and in Central, and Eastern Health, I'm told, will be issuing their own advisory a little later on this afternoon. The mRNA stream is the 70 plus, which are currently being worked through. They're registering, and the doses and appointments are being offered, starting with older earlier. And that's in the hands of the regional health authorities. One of the challenges they have experienced is people seem to be reluctant to answer their phone when called. And it may well be that this is a no-caller ID or a private number or a number they simply don't recognize. I would encourage people who are waiting for a call back to answer the phone. We will, however, keep on trying, so you will not be forgotten. We have a deadline for the 23rd of April, whereby anybody over the age of 70 who has pre-registered will have been contacted. We will advise at the completion of that and also offer a mechanism, if needed, for those people who may have been left out. But please answer your telephone, and that will help the regional health authorities enormously. For those people in the 65 to 69 age group, I have had some concerns from them. They are a group as yet that has not been opened up for mRNA vaccine pre-registration. We will advise when that happens, and then there'll be an opportunity for you too to take advantage of the shots. So with that, I think I really don't have much more to add today. Hold the line. We need to continue with our public health measures until we get to our target of fully vaccinating everybody in the province. So with that, Premier, I'll turn it back to you.
Well, thank you, Minister. I'll certainly, everyone should answer their phone. It's hope calling in this case, so you should pick it up and get the vaccine if you have registered. In the meantime, we'll open it up to media for questions at this point.
Thank you, Premier. For the benefit of our speakers, there are 5 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. The high schools in most of the Atlantic provinces are all back in class, as far as I know. Why is it we are still reluctant to go full-fledged in-class teaching?
So we've made our recommendations based on what we felt was the best available evidence, based on the evidence of the potential for the introduction of variants of concern. We saw the effect that could have on a high school population. So we're trying to reduce that risk as much as possible. We will be revisiting it. As I said, we will try to balance it based on risk as well as vaccination rates. And, we'll be continually reevaluating and deciding where we go with it in the coming weeks to months.
No, okay, because speaking of the Atlantic provinces, next week we're set to actually rejoin the Atlantic bubble. Won't that increase the risk of new variants entering the province?
So if the risk of variants are increasing in the Atlantic provinces, then, that will certainly make us reconsider the Atlantic bubble. As of right now, we feel our risk is about the same everywhere with regard to that. There are different reasonings behind the decisions, and we are looking at the situation that schools are and the way that children have to interact in schools, and the fact that people are in an enclosed space for a period of time together, which increases the risk of spread if there is introduction. So I don't know that they're mutually exclusive, or that you can use one to exclude the other.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
I want to continue with a question for Dr. Fitzgerald about high schools and being full-time. Even provinces that have active cases of the variant right now are still able to find a way to have full-time in-person instruction. What would you need to see change in order for your health advice to change?
So at this point, certainly we're looking at vaccination rates. We're looking at rates of variant spread outside of the province. And if we look at some areas that have significant increases in variants, they have actually closed high schools and they've moved to online learning at this point. So, I think we have been conservative in our approach, and I think we have kept COVID at bay because of the way that we have approached things. So, this is the best balance that we feel we can strike at this point. So we would definitely be looking at the risk of spread of especially variants of concern elsewhere in the country, as if we were to see that risk of transmission was decreasing, or the transmission was decreasing, and our case counts were going down, and that there was some indication that perhaps vaccine was impacting the spread of disease. That certainly would be something that played into our decision making.
And my next question is about Saint-Pierre and Miquelon. The government there says they would like to join the Atlantic bubble. This would, of course, in part be a federal decision. But Dr. Fitzgerald, I'm wondering whether you feel it would be safe, considering their high vaccination rates and low case counts right now. And Premier, will you support the idea in your discussions with the federal government?
We have to look at, there's a few things. I mean, certainly with regard to the Atlantic bubble, we've been coordinating with the other Atlantic provinces, and we've been talking about our border measures and exactly what they are. We're trying to be as consistent as we can when it comes to the borders. The same would have to hold for anyone else who we were looking at with that. So, I can't really comment on something that's really at a federal level at this point as to whether that can happen, but those same discussions would have to happen.
Peter, from my perspective, this is obviously a federal government decision and one that we need to respect. It's a border between Canada and France and not a border between Newfoundland and the rest of the Atlantic provinces. But certainly I would echo Dr. Fitzgerald's advice and concerns that it certainly depends on, we would hope they would make that decision on the balance of public health and the epidemiology. And you're right that the reported rates of vaccinations in St. Pierre and Miquelon are high. But as I understand it, there may be direct flights coming from France. So there are other things to consider when making that decision. But let's be clear, that decision is squarely with the federal government. Just like they make a decision on the border of the United States and Canada, this is between Canada and France.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Speaking of the Atlantic bubble, Nova Scotia announced yesterday that it's opening its borders to the rest of Atlantic Canada. And I know that the Atlantic bubble deadline is fast approaching on April 19th. But are we planning to make similar changes sooner?
The intention is to stay with the 19th right now. I did speak with the Premier PEI, and his intention was to stay the same. And I spoke with Dr. Fitzgerald, and our intention is to stay focused on the 19th at this point. Things can change, obviously, but we're still all focused on the 19th.
And Dr. Fitzgerald, in your opening remarks, you alluded to the spiking cases in other areas of the country. With that in mind, do we need to change our approach in any way to help protect against that spike coming here?
Well, yeah, we do need to think about, we've been saying for a while now that we need to think about this. It is essentially like a new pandemic in some ways. So we need to be more cautious about our own public health measures, and that, we're distancing and wearing our masks and trying to reduce our contacts. We need to be more vigilant about that. We've looked at, particularly up to this point, rotational workers and how we can integrate testing as a way to help reduce the risk of the importation of these variants of concern. And we're still looking at ways in which we can incorporate testing into that risk reduction.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Now that you're going back to a blended mode when it comes to high schools, are teachers going to be moved up on the vaccination list, especially considering the last outbreak stemmed from a high school setting?
We have said that teachers will be in level 2, and that still remains the case. We do have some higher risk groups to get through, some priority groups to get through before we get there. And so certainly, we're working through all of those right now. So I think our position with regard to that stands where it has been. We recognize that having teachers vaccinated is important, but we're trying to get through those people who are at higher risk for severe disease at this point, and that's sort of our priority at this point.
Vaccination or pre-registration for the mRNA vaccine remains with 70 and older. We're seeing these clinics pop up for the AstraZeneca vaccine. So where exactly are we in terms of progression through phase 2? Are we 10% of the way through, 50% of the way through? I think people have a lot of concern now that we haven't seen that pre-registration open up more.
So I think we're on par with where most people are, most provinces are across the country with opening up. A lot of places are where we are right now with 70 and above registering for vaccinations. That is certainly, the people who are 60 and over is the biggest group that we have to get through. That's where most of the people are. But there is still a significant group with regard to essential workers who have to work in person through level 5. So, it's difficult for me to say at this point exactly, how far we're through, what percentage we're through. But certainly once we get through the 70 and above, that's going to be a significant chunk of the priority populations that will be vaccinated.
Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
I'm 76. I think I'm probably the only person on this call in the 70-plus cohort. And I got one of those vaccinations on Monday night. The whole process was really smooth, from the pre-registration to getting an email inviting me to make the appointment, making the appointment, getting the vaccination. I must have been channeling Dr. Fitzgerald, because it was only afterwards, when I was waiting 15 minutes to be sure there was no side effects, that it struck me that I failed to even ask which vaccine I was getting. I was just happy to take whatever they were offering and leave with an appointment in July to get a second one. So my experience has been, that was pretty good. But Premier Furey, I wanted to ask you what specific factors explain why you missed your target of vaccinating 80,000 people by the end of March. Dr. Haggie has been talking for a few weeks about the target being 80,000 doses administered by the Easter holiday weekend. But what you said was going to be the target was 80,000 vaccinated by the end of the month. To borrow a sports metaphor, what Dr. Haggie seems to have quite artfully done, I would think, is move the goalposts and put some more time on the clock. I went back and listened to the recording of the March 5th briefing, and you said, quote, "We will have 80,000 people vaccinated by the end of the month." And according to data on the government's COVID website on March 31, the end of the month, 60,000 people have been vaccinated, not 80, wasn't even close.
Well,
and the reason I ask you is that during a media briefing following the one on March 5th, I asked about the
Well,
rate
it's quite the preamble you have
vaccinated.
here now.
In fact, the province wasn't on track to hit 80,000. And I asked you if your earlier optimism had been colored by the pressure of being in an election campaign. You said no, it hadn't, that your forecast was based on evidence and the evidence hadn't changed. But you didn't get to the 80,000 mark, and you said the evidence you based your original estimate on didn't change. So the question is, what conclusion can people come to?
That we were off by 4 days.
Just to clarify, the deadline of the 23rd, is that to get everybody vaccinated in the 70-plus group or everybody in the phase 2 group?
That is to offer everybody who is over 70 who has pre-registered an appointment. If they haven't heard by then, we will put in a mechanism whereby they can be contacted or make contact again. That was my preamble around how it's important for individuals who are expecting to be contacted by the RHAs currently actually answer their telephone. We've had some challenges, particularly in Eastern Health, and there are maybe as many as 600 individuals who have not answered their phone after 3 tries. Now, Eastern Health are still keeping on with that, but it's the 23rd of April has been given to me by Western Health, Central Health, and Eastern Health as the date by which everybody who has pre-registered will have been offered an appointment.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi. Sorry, is there any information available on the number of vaccines delivered by health authority regions? There seems to be a discrepancy in the vaccine availability in Western Health, for example, and then in Eastern. Is that just a perception, or what is the explanation for that?
I don't actually have the breakdown with me by region. They are allocated, on my understanding, is on the basis of appointments that are booked, in the case of Pfizer, particularly because their supply chain is now stable and those appointments are booked out a week or 3 in advance, so they know each week how many appointments they have booked for each. And the two are tied together. But I can certainly find you those figures and get them for you. That won't be a problem.
Okay, thank you. And I've heard now from at least a couple of med students who are wondering why they are not being treated as frontline health staff, given that they are going in and out of hospitals, certain residencies, and other sorts of hands-on processes. Are they very high up on the list?
They would be under level 2, phase 2 rather. They would be those people who would work through level 5. Obviously, in a situation where we found a sudden influx of vaccine and needed to recruit, in addition to our pharmacists and physicians who are already on standby, recruit medical students, for example, to give the vaccine, then that would be an operational issue. But they are in phase 2.
Okay, thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Premier, I just want to go back to the Saint-Pierre and Miquelon bubble. While it would be a federal decision, that wouldn't be a move that they would make without the province being on board with allowing quarantine to be dropped and allowing movement to move more freely between the islands and this province. So what is your personal view on whether or not this is an appropriate time to be able to drop that quarantine requirement?
Certainly, if it's safe and the epidemiology is reflective of it being safe, and it's okay with our public health officials here, and frankly, aligned with the rest of the public health officials in the Atlantic bubble, we wouldn't want to jeopardize the Atlantic bubble. I wouldn't personally have a problem with it.
Okay, thanks. And I'm hearing from people who have relatives who are elderly, so still in the sort of 85 category, who aren't able to make it to vaccine clinics and have been told that they have to wait even as younger and younger groups are now being vaccinated. So what exactly is the plan to get to people who can't make it into a clinic, and how quickly will they be able to receive their vaccinations, considering they're in some of the groups that are higher risk?
Technical mass challenges, never had those in the OR. From the point of view of those people who are housebound and cannot physically get to an appointment, there is a mechanism through public health where at the time you are contacted about your appointment, you make that situation known to them, and then there are alternatives, essentially the option of a home visit. Obviously, this has to be used sparingly, simply because of the staffing challenges inherent in that. So this is something that would be discussed between the client and public health at the time they were offered their vaccine appointment.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Just to follow up on Peter Cowan's question there, I recently heard from somebody who was trying to get their mother vaccinated. This person's mother is over the age of 90 and needs one of those home visits, and was telling me that it's been a process that's been stretching out now for a number of weeks and is stretching out for a couple of months. So if someone were to need a home visit, what sort of wait time are they looking at, and why would there be such a lag?
The short answer is I can't give you an answer without going back to the regional health authorities, and I'd be happy to do that, and we'll report back to you.
Thank you. And workers in the fishery have been deemed essential, and the opening up is just around the corner, which means people will be in congregational settings such as fish plants and boats. Where do workers in the fishery sit on the priority line, and is there any thought of potentially moving them up as the opening is just around the corner?
Certainly, for people who are working in food processing plants, so, we have seen significant outbreaks in other parts of the country in some of these processing plants. So and that, of course, then is makes it an increased risk in communities as well. So certainly we recognize that these work facilities are a target for vaccination in that group of essential workers that are working through level 5.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. With the AstraZeneca clinics, those are for 55 to 64, and I'm not saying all rotational workers fit into that age category, but we looked at moving that vaccine to rotational workers, as we know that travel is one of the main causes of virus getting into the province.
Sorry, Kellyanne, are you asking, would we move AstraZeneca to all rotational workers? Is that what you're asking?
Yes, those that would fit into the category allowed for AstraZeneca.
Yeah, so anybody who's in that age category can actually, book an appointment for the AstraZeneca. So if they are a rotational worker, certainly they can book that appointment. But no, we haven't moved it specifically for all rotational workers. And, you want to make sure we're getting as many people as we can vaccinated. And so we are having an open call for that age group.
Thank you. And when it comes to looking to pre-register for the next age grouping, whether that be 65 to 70 or 60 to 69, is there a timeline on when that potentially could open for people?
There is going to be on the website later on a graphic of timelines for phase 2, and that should be up later on today. Specifically, 65 plus is referenced, and 55 to 64 shows that we're running April through May. It's very difficult to be more specific than that, simply because of vaccine supply. Whilst Pfizer is stable, we know we can count on around 20,000, 16 to 20,000 doses a week of Pfizer. Moderna is a little less predictable, and it is allotted on a 2-week schedule. So it's a little difficult to give really hard and fast guarantees about dates down to the week sometimes. In general, we are still well on track for offering a vaccine to everybody who's eligible, single shot, by Canada Day. And that's not that far away. So as Dr. Fitzgerald referenced, we've seen over a third of our entire vaccine allotment arrive in the space of the last 7 days. And I think the RHAs are doing a really good job at getting it out there promptly.
Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
I don't have a question. Thanks.
Thanks, Roger. I will now go back through each reporter to see if you have one final question. Peter Jackson with the Telegram, do you have a final question?
Yes. Just with respect to the AstraZeneca clinics, I've had people tell me that they are pre-registered because they're in certain priority groups, and are wondering why they weren't contacted about the AZ rather than opening it up to everyone.
I may have misheard you there, Peter. These are people who were basically eligible for 2 categories, one on the age basis, AstraZeneca, and the other because of some higher risk issue or priority for the mRNA. In general, our advice has always been to take the appointment for the higher risk category, or the one that will get you in sooner if you're in the fortunate position of falling into 2. I'm not quite sure I understood the question beyond that, so I apologize if that hasn't answered it.
Sorry, can I just ask, since you didn't quite get it? There are some people who don't fall into the age category, but do fall into some sort of a frontline worker, first responder, Indigenous adults, that sort of thing, who may not have already received their vaccine and would have qualified for AstraZeneca. And they're wondering why they weren't contacted to use up this as AstraZeneca rather than putting an open call out to the general public who are in that age grade.
I think my understanding there, and I would defer to Dr. Fitzgerald on this, would be that if you were in a category for which the mRNA vaccine was recommended and you missed it, then it would be a lesser option for you to take an AstraZeneca shot. But that may be just my view. So I would defer to Dr. Fitzgerald under that situation.
Yeah, so if somebody, so right now, the only recommended age category is 55 to 64 for AstraZeneca. So if somebody was in another high priority group, certainly anyone who's over the age of 65, we're recommending an mRNA vaccine as per NACI recommendations. And the same with Indigenous adults at this point, which is the other group that we're registering right now. So we have, I'm not sure that we would be calling them to get an AstraZeneca vaccine if we're recommending that they would get an mRNA vaccine.
Okay, thank you.
Peter Cowan with CBC. Do you have a final question?
I do. It's one for the Premier. The cabinet that you unveil tomorrow is going to have to tackle COVID. We've seen the PCs today calling for a gender-balanced cabinet. We saw the federal government do it in 2015. Are we going to see an equal number of women and men when you unveil your cabinet?
Well, I'll see you tomorrow, Peter, when I unveil the cabinet.
Thanks.
Richard Duggan with BOCM. Do you have a final question?
Yes. Any word on when we will be getting our supply of Johnson & Johnson vaccine? What's the latest there?
None.
Yeah,
No new word. We haven't heard anything different.
Thank you.
Kellyanne Roberts with NTV. Do you have a final question?
Yes, thank you. Wondering if there's any changes coming to self-isolation when arriving to the province if you have 2 doses of a vaccine.
So at the moment, we are maintaining our public health measures as they are. We are still learning about how this vaccine will affect transmission of the virus. And we also have other variants of concern that we have to be careful about. So, that may not respond to some vaccines. So that's something we do worry about. And we have to remember that, we need to have a significant proportion of our population vaccinated. Even if the vaccine does reduce the risk of spread, we need to have our population vaccinated to ensure that that spread doesn't happen. So there's more than just a single individual's vaccination status to consider when it comes to lifting those types of public health measures.
Thank you.
Roger Bill with the Shoreline News. Do you have a final question?
No, I don't. Thanks.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you all for joining us. It's great to see our COVID numbers staying so low. So let's continue to do our part to keep the virus out of Newfoundland and Labrador, continue to follow public health guidelines, keep your social distance, use a mask, wash your hands. And as we get closer to summer, if you're planning to travel around the province, that's a good thing. We should enjoy our province and support our local tourist operators. They need it this summer as well. So everyone stay safe, and we'll look forward to chatting again next week.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.